Hi, I'm Dr. Jay Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world and give you expert insights on infectious diseases and public health. Today, I have a special guest, Dr. Tom Farley, who was formerly the Commissioner of Health of New York City, my boss at the time, and then later on at the Philadelphia Department of Health as well. And we're going to be discussing a topic that is, I think, really worrisome to anybody who has an interest in health. It doesn't matter if you're a healthcare worker, a public health worker, a researcher, or just a regular concerned citizen. But on April Fool's Day, or what some of us in public health are calling the April Fool's Massacre, there were massive cuts to all of the agencies across the Department of Health and Human Services. This is part of the larger plan that President Trump has been discussing actively, and obviously using Elon Musk as the executor of. But it finally really hit the health agencies of the U.S. government on April 1st. And I brought on today Tom because he's done a lot of discussion and analysis of what's going on, and has recently written an article on Substack that you'll find in the description of this video, to discuss kind of what the larger context of all this is, why it's occurring, and what the potential impacts are. So Tom, thank you very much for joining me today on this episode of Thermometer.
Good to be here.
So Tom, let's start with the big picture here. What is your kind of overall reaction to what's happened in the past week?
Well, focusing just first on the CDC, which is one of many health agencies that have these cuts, I would say these cuts are devastating. They're going to be devastating to the field of public health, and they're going to be bad for the health of Americans. And before I go any further, although these are presented as budget-saving measures, this is not about saving money. I estimated that the amount of savings they would get over the course of a year from the cuts that they have done is less than what the Center for Medicare and Medicaid Services spends every 3 hours. So, if Kennedy wanted to save money, there's a lot smarter and more effective ways to do that while protecting our health. This is really about ideology, and it's about politics, and it's about control.
Yeah, and I think this is where those of us in public health really kind of like tear our hair out. It's like, if you really want to save money, we in public health want to be good stewards of public services. We pay taxes as well, too. We want our money to go for good purposes as well. And, you have to look at everybody's wallet, because if you learn as kids that prevention is better than cure. And that one of the reasons prevention is better than cure is because it saves you money over the long term. And so, Tom, what are some of the areas that you've been particularly concerned about or seen as part of this ideology of cost cutting, where it's going to hurt us, not just in our health, but in our wealth as well?
So, there's been no official list put out by HHS about what units have been cut. So much for radical transparency. But the staff at CDC have kind of crowdsourced a list of the units that have been eliminated or severely cut back. And you can see some clear patterns here. So first, they eliminated the Division of Reproductive Health. I assume that they think that has something to do with abortion, even though it doesn't. That's about helping women have healthy pregnancies. They made major cuts in the Division of HIV prevention. I assume that's because I think that only helps gay men. And they eliminated the Division of Violence Prevention, which is about guns. From their minds, it's about guns, and to us, it's about saving lives. Then you can see the hand of industry in a lot of these cuts. The fossil fuel industry, for example, they eliminated the program on climate and health, the program on asthma and air pollution, and overall made major cuts to the Center for Environmental Health, which is the center that looks at the health impact of air pollution and water pollution. You can see that they did major cuts to the National Institute for Occupational Safety and Health. Apparently more than 2/3 of their staff were eliminated. This is the unit that does research to protect workers for worker safety. For example, coal miners. That unit, the coal miners health unit, was eliminated. And then most upsetting to me is that they eliminated the Office on Smoking and Health. Now, probably not a lot of people watching this are smokers, but smoking is still the #1 underlying killer in America today. This is a small unit given the size of the problem. And why would they eliminate that unit? Well, because the big tobacco companies donated millions of dollars to the Trump campaign. So this is industry payback. And then the third pattern I see in all this is control. What the cuts have done is eliminate the units in the CDC that do communications, IT, human resources, and contracting. So basically all the levers that a CDC director would use to manage the agency are now being centralized under Kennedy. It gives the CDC director very little power, and it puts Kennedy, a lawyer who has loopy ideas about health, puts him in charge of protecting our health.
Yeah, I just have to say you and I have talked before this and tried to figure out some type of logical through line as it relates to health, and it doesn't exist, right? There is no way to actually tie this together with even if you have a totally alternative worldview of what health is. There is no logical through line to any of this, because even if you are part of this Kennedy Maha movement, you should be worried about contamination of your air, of your food, of your water. That is part of the sort of the language that they use oftentimes. So really you have to switch your attempt, switch your logic to this and think about what is the logic. And you really hit on it. The logic is power and control, right? It's who are the centers of power that have contributed to this current administration, to winning its elections, to maintaining its power? How do you retain that power over anything that might impact humans out there? And one of the ways to do that is to centralize that. And you and I know from working in public health practice for so long that there are some functions that are great when they are centralized, but basic things like printing educational materials or educational videos, that really does belong at this sort of scientific level, working in collaboration with the scientists and the public health people to try because it has to be tailored to the subject matter that you're working on. But clearly all of these things are fundamentally about control. And the sad part is they're going to cost us in the future, right? They're going to cost us in illnesses, in deaths, and in economic productivity loss.
So let's talk about communications for a second. People who are elected officials like Kennedy and politicians see communications only as a means of self-promotion. They don't realize that communication is the core of what we do in public health. We get expert information, get information and expert analysis, and communicate that to doctors and state and local health departments and the public so that they can protect their own health. So there are units throughout CDC whose sole job it is to communicate that information. And it's not political, it's just allowing people to make smarter decisions. If all that is centralized into a political communications unit at HHS, that means that everybody will be making decisions that are not as smart. It's what I refer to as the great dumbing of American health system. It's an awful change and something that we should say is just not acceptable.
Well, yeah, you raise a really important point. And for those who are watching who may not know this, CDC actually has very little ability to create regulations, right? CDC's only regulatory authority historically has been at ports of entry into the United States. So if you enter the United States, being screened for certain conditions that are written into public health law, that you have the right to investigate that, and also vessels that travel on in U.S. waters. But beyond that, CDC actually has very little regulatory authority. But what it has had historically, and I really emphasize historically, is credibility and a microphone that can be used to get information out to healthcare providers, to settings that are really important, whether it's workplace settings or schools or other things, and to get information out to people out there. And so the way CDC wrote its guidelines, the way it then translated those guidelines into education and awareness material has really just been fundamental to how public health has worked in the United States and progressively improved over the past several decades.
Just as one example, they eliminated the tiny unit within the Division of Tuberculosis Prevention that's responsible for communications. So that'll mean that healthcare providers who are treating people with tuberculosis or their family members will just not be informed and make as smart decisions as they should on how to control TB. And so that's going to make TB more likely to spread. Now, TB right now is fortunately a small problem in the United States, but it's a big problem across the world. And so we do a lousy job of it here and across the world, which we're doing, then it is likely to come back here.
Yeah, and if you ask them, if we had somebody from HHS or DOJ here, they would say, no, we're not stopping communication about infectious diseases. We're just making sure that it all meets the standards that we want to do. But we all know that one of the ways to reduce the flow of communication is to create a backlog, right? Anybody who's worked in any type of organization, whether it's government or a large corporation, knows that you can slow stuff down. So what they will argue and try to say is that we're not stopping communication. We're just going to make it more efficient. And so any of you, of course, who've worked in an organization know that, or think about what happens to the call centers, right? All of a sudden you're on hold. And the same thing is going to happen anytime, I used to work in the division of TB elimination. I worked there for 5 years. If you're going to have communications materials, you're now going to have to probably put it into some central queue that gets sorted with thousands of other requests, and it's just not going to happen. Or if it does happen, it's going to end up being way too late for the problem that you were trying to address.
I would say, this may be putting it too strongly, but maybe not be putting it too strongly, is what they're trying to do is transform CDC into a propaganda arm of the Trump administration, the Republican Party. And CDC has been strong in many ways because it's in Atlanta, because it's been separate from politics, and it can speak as health experts. I don't think Americans want their health agency to whom they turn to for scientific advice to be politicized. And so I think all of us really need to complain about this.
Yeah. And of course, this is going to be the underlying tension, right? One of the parts of the COVID backlash is the feeling that CDC's decisions weren't grounded in science and that they were too political and they were an attempt to control the American people. There is a reasonable debate that people can have about, what is the balance between personal liberties and, sort of community rights and protection. But gutting the expertise that has been built up over decades, and the expertise that from people like us, people like myself who have worked extensively overseas, has been revered throughout the world. This is not going to make America, and I'll keep emphasizing the point, it's not going to make us healthier and it's not going to make us wealthier. What it is going to do is make workers less safe. It's going to make our pregnancies, we're not going to, a lot of this reproductive health stuff that they're doing is they want to get rid of the monitoring, pregnancy risk monitoring, how CDC has been trying to get the evidence and garner the evidence to improve our abysmal, infant mortality rates, is to collect really good quality data about women who are in high risk pregnancies and what happens to them. You got the data, and then all you get to do then is, because you don't have data, you can make political decisions about it, right? And the same thing is true with worker safety. If there's a mining accident, they're going to come out and say something because they're elected officials. They have to say that they're there to protect people. But if there aren't scientists and people in the background examining what the high quality data is, then your intervention that you can make can be one that's entirely political and one that aggregates, power to yourself without actually necessarily improving the health of anybody out there.
So again, to me, devastating cuts to the CDC, bad for American people, and I don't think we should just tolerate them. I think people should stand up and say, I don't want our lead health agency to be gutted this way.
So what would you recommend? What do you think viewers out there should be doing? What are some steps that people can possibly take in this time where it seems that many of us feel powerless, like these cuts are just happening and there's nothing we can do about them?
Well, in general, I say we need to be supporting the CDC and then supporting state and local health departments, which will have to fill in some of the gap. And the way to support CDC is to contact your elected representative and say, these cuts are unacceptable. CDC needs to be an expert scientific organization, not a political arm of the Republican Party. And then also contact your state representatives and say, we need to beef up the expertise of our state health department to fill in the gap where CDC will not be trusted in the future.
Yeah, I agree with you completely, Tom. And so if you're a viewer out there of this show, really try to make your voice heard. You can make it heard on social media. You can call your elected officials and do it at every level of government, because there is a likelihood that we're not going to be able to immediately reverse these changes at the federal level, but we can make sure that our state and local health departments are resourced enough that they can fill in at least some of these gaps. So do everything you possibly can to make your voice heard about why public health is important and why we need to do everything we can to fight for it. Thank you, Tom, very much for joining me today. I really appreciate your perspective and expertise.
Thank you.
Great. And so if you enjoyed this episode of the Thermometer, please hit like, please hit subscribe. And as I mentioned earlier, if you want to read more about this topic, Tom has a great Substack called Healthscaping, where he's keeping you up to date on these issues and giving you his many years of expertise and turning them into really comprehensible and great reading material. So thank you, everybody, for joining us today, and look forward to seeing you soon. Bye-bye.